But let's get to the healthcare reform. I have been seeking healthcare reform, for a long time as a member of Congress. I've been in Congress 20 years. I've served on the Health Subcommittee for about 15 of those years. I've chaired the committee for a little over 2 years now. And of course, the first time that I've chaired it with a Democratic president. Many of you know that during the course of the presidential campaign, it was a major issue for not only Obama, but also for McCain. And I do believe that we need reform. I don't think that we can continue with the status quo, because I think that more and more people every day go without insurance. I forget what the number is, something like
47 million.
47 million, but the numbers, every day there are another 14, 15,000 people who have insurance who lose it. So the number of uninsured is going up. The cost of insurance for people who have it continues to rise. And of course, the cost of the healthcare system overall continues to rise, way out of proportion to inflation. And the numbers are much greater than they are in terms of what we spend as a percentage of our gross national product in almost any other country in the world, even vis-a-vis countries that, by any standards are, if not as good, certainly close to as good as what we provide. So there's a problem, and I know there may be some people here who think there isn't, but I do think there is, and that's why I do think we need reform. The president laid out when he was during the campaign and when he was elected and took office in January, a set of principles to guide the Congress on what kind of reform he would like to see. There are a number of bills in the House and the Senate that are moving that would abide by those principles. They're not all the same. However, in the House, which I'm going to concentrate on in the next couple of minutes here, in the House, beginning in January, the chairman of the full committees and of the subcommittees, including myself, there were 6 of us, who sat down for about 2 or 3 months, maybe longer, and tried to come up with a bill that we could agree on and move through the 3 committees that went along with the president's principles. And we did that, and we basically came up with a bill in May or June, which we had hearings on in my subcommittee, and then we tried to move those bills through our committees. And each of the committees, my committee, Energy and Commerce, and the 2 others, did actually report a bill. We did it on the last day of July and the last day of the session before the August recess. I think it was actually July 30th to July 31st. What I will probably talk about tonight, mostly in response to your comments or questions, will be that bill, because that's the bill that not only I am the sponsor of and had a lot of input into putting together, and so I take pride of authorship, but also because I think it is the bill that likely will go to the floor of the House and be the centerpiece of what the House passes. But I do want you to know that there are other bills out there, so that there may be some. When I say, okay, this bill versus another, I'm mainly talking about my bill, the bill that came out of the Energy and Commerce Committee.
What's the number on that bill, Congressman?
It's H.R. 3200. Okay? Now, what is it? I mean, I could talk all night about what it does, and I really want to hear from you tonight, not talk. But I do want to say the following. The main gist of this bill, in my opinion, this is just me, is to try to cover the uninsured and to try to make an affordable health insurance policy available for those who are uninsured or those who buy their insurance in the individual market or get it through a small group plan, like where there's under 10 employees, okay? Now, I say that because a lot of attention has focused on Medicare, which I don't really think changes much, if at all, under this bill, or on Medicaid, which again I don't think changes much, if at all, or on employer-sponsored health insurance, which something like 60% of Americans get their health insurance through their employer. So I think that if you take the people who have employer-sponsored insurance, the people who are on Medicare, the people on Medicaid, it really doesn't change much about how their insurance is delivered or what's covered. There are some changes, but not much. The main thing this bill does is to help people who have no insurance, many of whom simply can't afford it, oftentimes because they have a pre-existing health condition, and when they go out on the open market, and try to buy an individual policy, it's just too prohibitive because they have diabetes or some other precondition. And what the bill says is that those ratings that are based on those health preconditions or based on gender or other things are abolished. And what the bill does is set up a health exchange, meaning a government-run exchange, if you will, whereby private insurers, whether it's Blue Cross, Aetna, whatever, can come to the health exchange, and if they provide a basic benefit package, and the government defines what coverage there has to be, they can then sell that insurance without any ratings, for pre-health conditions or whatever, through the government exchange. Now, in the House bill, H.R. 3200, we also have a public option. You could compare it to Medicare if you want, but there are differences from Medicare that exist along with these private insurers that are available through the exchange. Now, if you are uninsured, the reason why you would go to that exchange and probably get insurance that you can't get now is for several reasons. First of all, it acts like a large group plan, and so prices come down significantly from what you purchase in the individual market. There's no rating system, so if you have a precondition, they can't charge you anymore. In addition to that, we expect the public option to compete with the private insurers to bring costs down. But probably most important, there's a major subsidy from the federal government that goes along with that. So that if you're not eligible for Medicaid because you're just above the poverty line, you would get like an 80% subsidy. So think about it. Right now, if I'm in New Jersey and I have major health conditions and I try to go buy insurance on the individual market for a family of 4, I might pay $25,000, $30,000 a year because of my pre-existing health condition. I go to this marketplace. They can't charge me more because of my pre-existing condition. It acts like a large group plan. I probably get a major subsidy. So rather than paying $25,000 a year, I might end up paying $2,000 or $3,000 a year. Okay, and that's the major advantage of this. If let's say I have no pre-health condition now, I'm paying about $12,000 to $14,000 a year for a family of 4 in New Jersey if I have no health conditions in my family. Well, you probably, I believe, without a subsidy in the health exchange, would probably be able to buy a policy that maybe would be only $9,000 or $10,000. If you're eligible for a subsidy, which goes up to $75,000, $80,000 per year for the family of 4, you can bring that down accordingly. It applies also to small group plans for less than 10 employees. It's very hard for them to buy a cheap health insurance policy. So the main advantage to this, those who are uninsured, those on the individual market, small group plans, can't get insurance now except for a very high amount. They go to this health exchange and they can buy very inexpensive insurance. I mean, there's so many other things. I think I've got to just stop here. Let's just start taking questions.